Stroke hospitalizations among younger adults increased nearly 50% since 2007. But the good news, the odds of adults under 45 dying from a stroke have dropped. That's according to new research just presented earlier this month at the American Heart Association's Quality of Care and Outcomes Research Scientific Sessions. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, during Stroke Awareness Month, we're talking about what may have led to this trend, who is at higher risk, and stroke prevention. With me today is Dr. Karin Olds, a neurologist and the stroke medical director at St. Luke's Marion Bloch Neuroscience Institute. Thank you so much for joining us.
Thanks for having me, Lindsay.
So, Dr. Olds, what insight do these new findings offer on why stroke hospitalizations are rising among younger adults?
I think it's really twofold, Lindsay. First of all, I think the stroke warning signs are more well known, and I think we're recognizing that younger folks also have risk for stroke, sometimes different risk factors. But overall, the primary risk factors for stroke, such as obesity, heart disease, high blood pressure, high cholesterol, diabetes, those are on the rise among young adults as well.
Okay. So as hospitalizations are rising, why are the deaths decreasing?
Well, the study that you mentioned doesn't really address that, but I think that our stroke reversal therapies and stroke care in general have really come a long way over the last 10 years. So I think that's why we're seeing better outcomes and less death with stroke overall.
Well, that's great. So previous studies suggest that women face a higher risk for stroke. Why is that?
There's several reasons, but we know that women and young women, but also postmenopausal women, estrogen, especially when combined with high blood pressure and smoking, can increase risk of stroke. So oral contraceptives that contain estrogen or estrogen replacement therapy. Pregnancy also carries a risk of higher likelihood of thrombosis or clot formation. So that puts women at higher risk than men.
Okay, very interesting. So what are the warning signs of a stroke?
We like to teach the acronym BFAST. That's the easiest way to remember it. So B stands for balance, sudden onset of loss of balance or room spinning vertigo. E stands for eyes, and that can be a sudden onset of double vision or loss of vision, usually in both eyes in a congruent type of defect. FAST is face, arm, speech, time. So facial droop, one side or the other, facial weakness. A is for arm, so one side, arm weakness. S is for speech, loss of speech or slurred speech. And then T is time, get help right away.
Now explain the importance of seeking treatment immediately.
Well, Lindsay, about 32,000 brain cells die every second that the tissue's without oxygen. All of our stroke reversal therapies have time as a major aspect of it. So we have a few hours within the symptom onset of stroke in order to be able to deliver the IV thrombolytic or clot busting treatment. We have a little bit longer time if there's a large vessel or a major vessel blocked in the neck or in the head. Our wonderful team of neurointerventionists can go up inside the vessels and try to get that vessel open with different types of devices. The sooner that you restore blood flow to the brain, then the less likely you are to have long-term consequences and deficits from stroke.
Okay. So what are the best ways to prevent a stroke in the first place?
First of all, it's important to know what your risk factors are. So age, gender, genetics, those are risk factors, but those are considered non-modifiable. The modifiable risk factors that we talk about the most are high blood pressure, and it's important to know what your blood pressure goals are and to work closely with your doctor to make sure you reach those goals. Diabetes is a big risk factor, and diabetes is on the rise. It's important to know if you're diabetic, if your blood sugar runs high, and therefore what is your target goal. Diet and exercise, medications are all important. High cholesterol is another risk factor that's very predominant in our region and in our culture. And knowing again what your cholesterol goals are and working with diet, exercise, treatment, medications with your doctor to get that under control. Smoking is still a big risk factor for stroke. So if you don't smoke, don't start. And if you do smoke, quit.
Okay, great. Well, thank you so much for joining us.
Thank you, Lindsay.
To learn more about how St. Luke's is on the leading edge of stroke care and the different types of stroke, visit stlukeskc.org/stroke. You can also stay up to date with all the latest health news and patient stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.